Dear friends, I am so happy to meet today, Saturday, 5 p.m. because today we have finished 1388 cases of Puberphonia. It is a great achievement for us, and we are continuing this treatment every day. Even Sundays, the boys are doing the training, but we are taking the leave because they are staying here. Three boys are now taking training for post treatment. So, with this, we are able to achieve a small height in our experience. So, what is why we are going to do? I, or our Puberphonia eradication program, we want to make Siva ENT Hospital. There are two branches. One is in Lloyds Road with the hospital, accommodation, everything. And another thing is the outpatient department at Triplicane. So daytime, the hospital is running. Evening, the clinic is going on. So this hospital, I want to devote the whole energy and my experience in treating puberphonia. So we are thinking of, or we have already started, I can say, my mind is there that we are exclusively, our Siva ENT Hospital, we are going to have a Puberphonia Kumaresan remedy clinic. Just like audiology, speech therapy clinic, all the things. We are opening a Puberphonia clinic. And my great writer, Nanjil Nadarajan, respectable Nanjil Nadarajan, had put in Google's Puberphonia Kumaresan remedy. So I was so thrilled to see that in Google's, if you have the opportunity to go in Google, Puberphonia Dr. Kumaresan remedy, Puberphonia Kumaresan remedy. If you just in the Google, if you just type Puberphonia Kumaresan remedy, you will get an article by Nanjil Nadarajan, the great writer, international writer. There you will get yes, in ENT research, Journal of Otolaryngology, in medical education. So you will get an article by name Puberphonia and Dr. Kumaresan remedy. This is in academia education. So he has published it in academia education. The title of the paper is Puberphonia Dr. Kumaresan remedy. So now I thought I will go ahead with the name. Yes, Puberphonia, Dr. Kumaresan remedy. As my clinic, our clinic name itself, only like that. Just like Puberphonia clinic, why not we have a name as Puberphonia Dr. Kumaresan Remedy Clinic. So he has given a good introduction in the Google. If anybody want to see, they can see it. There we have what we have. Our article he has referred an immediate and permanent cure for Puberphonia. Our address, short communication also, and new technique in management and concept of the therapy. He is a well-known Tamil scholar, so he has included Tolhapia, what he has told about the production of the voice 2500 years. And in the conclusion, he had told a small technique of treatment of puberphonia was illustrated by me. The treatment is permanent and immediate. The treatment also completely eliminated the old theory of endocrine imbalance, failure of development of secondary sexual characters, mutation disturbances, abnormal functional adaptation, deep-seated psychological problems, immature voice, chest voice, breaking voice, immaturity, fear of adult responsibility, losing maternal protection, hero worship of the older boy, feminine tendencies, rejection of masculine voice, small larynx, short vocal cord, and natural tenor voices. So he has told it very clearly what is our object. So that had given me a more encouragement. So why not this we will continue as Puberphonia treatment center or Puberphonia clinic. Why not a Kumaresan Puberphonia eradication or center or treatment center? So we have conducted extensive research on physiology of speech organ to identify the root of the disease Puberphonia. And our treatment is also successfully and saves the future of many younger men. The historian Nanjil Nadarajan suggests Dr.M.Kumaresan described his achievement a simple procedure, and it is due to his simplicity and nobility. He has found out treatment for puberphonia is indeed a great achievement and invention in the medical field. He suggested let us call as Kumaresan remedy. So this has initiated us to organize a clinic as Puberphonia Kumaresan Remedy Clinic. Because other ENT surgeons should do this procedure and eradicate, our aim is eradicate the Puberphonia from the world. Focusing and correction of puberphonia voice takes only a few seconds by Euler manipulation and resonance that we have found out. But learning to use the voice correctly in conversation takes time and practice for 5 to 21 days. Yes, a new voice habit. Definitely, it may take few days, but theory of habituation says 21 days is the ultimatum. It will be registered in the brain. So this had given us a new dimension to start a puberphonia clinic in Siva ENT Hospital exclusively in 2,500 square foot, one floor, another 2,500 for treatment center, and 2,500 square foot for accommodation. 3 floors hospital exclusively for puberphonia. In the way we want to suggest, all are happy because our experience suggests it is curable without surgery and medicine. We can change the voice, change the pitch of the voice. So, for that, we have created a frequency analyzing machine, a computer aided. If you speak in the mic, it will go to the computer and it will analyze the frequency, and you can immediately see in graph manner what are the frequency, which words are in low frequency and high or high frequency. Then you can take a photo of it, snapshot, or directly you can take a photo of the computer screen. So you will talk and you will find out your own frequency. So this give a great good impression for puberphonia boys, because puberphonia boys are having lot of doubt. Am I having puberphonia or not? What is this type of voice? Is it mutated or false voice? All the things are there. But they will get more upset when somebody calls them in phone and recognize them as lady. That's all. That only create a impression to them about the voice, because friends, relatives, parents, they fail to understand the frequency of the voice because they are hearing from the birth itself the same voice. So by body itself they will be able to recognize, oh, this is our son, that's all. But in the phone call, they are recognizing different, that's all. That hurts them. That only direct them to ENT doctors. Why not you treat it? That's all. If they ask somebody, they recognize it, but still they will suggest, you're all right, don't worry. This little change in voice, it will automatically be all right. But this voice hurt very much. Oh, in phone call, they recognize me as a lady. So now we are able to assess the frequency of anyone. Just walk in, within a minute we will tell what is the frequency, because they are speaking and they are seeing their frequency in the computer. So this is the first equipment all ENT surgeon who think that they are able to treat puberphonia, they should be equipped with that. Yes, even if you want to do some surgical management also for puberphonia, many doctors are doing good surgical management for puberphonia. So they should have this mission. This I have made it with the help of computer engineer in Rich Street in Chennai. And so this is helpful. After assessing with this instrument, the puberphonia boys are very happy. Oh, this doctor is able to identify the frequency of our voice and the frequency of not only that voice, whether it is male voice, female voice, or some words are in a male range and some words are in female range. In female range, so they will be able to get an idea. So nowadays, many adults who are having speech problem, they are coming to me. What happened to my voice? Doctors or ENT surgeon professionals done endoscope. They say it is normal, but still my voice is very bad. So what is this problem? Kindly tell what is the change in frequency, what had happened. They have done endoscope, they show me that. So picture they will show me, but I will be able to assess the frequency. Very great thing, I am happy. So this is one more ornamental one for all ENT surgeon. They should have a frequency analyzer. So in having so, they can diagnose puberphonia and problem with stroke, problem with stuttering. Yes, lot of boys are there with stuttering without, no, my feeling is good treatment is available, but still a definite treatment for stammering or stuttering is still I am not able to aware of it. Yes, surgeons, speech therapists, they are doing good treatment, but I am not aware of a definite treatment for stammering. Similarly, muscle tension dysphonia, very good treatments are available, injection treatments, surgical management, very good treatment, but a definite treatment, conclusive treatment is not yet to achieve. That's what I personally feel. Similar to dementia, you're having voice problem, brain injury, traumatic brain injuries, and articulation problems, hoarseness, in autism spectrum disorder, Down syndrome, cerebral palsy. These are the problems they will have, voice problem. They are coming to me, and what more we can do? Because, take for example, cerebral palsy. They had the problem of hemiplegia or something like that. They lost the walking capacity, writing capacity, memory, all the things that happen. Slowly it has improved. But voice is not improved. What can we do? See, many don't know where to go also. Adult voice problem, where to go. Small children, if they are not talking properly, the public will know where to go. Good speech therapists are there, ENT surgeons are there, good clinics are there, so they know children with speech problem where to go. But adults with speech problem, in puberphonia, stroke, stammering, stuttering, muscle tension, dysphonia, dementia, brain injury, traumatic brain injuries, articulation problem, hoarseness, autism spectrum disorder, Down syndrome, cerebral palsy. Still, exclusively a speech therapy clinic. Yes, many doctors are saying, I'm not telling they are not saying, but exclusively clinic, I think we can start because we are having a good equipment to assess the frequency. So this is our aim. Adult with a speech problem means we will be able to help them. We will be able to treat them. That's the thing we can say. We are not telling that we will get a good voice. Immediately you will be all right. These are all the things we won't be able to tell in the medical field. We treat, that's all. The God should give them a good speech, whatever they want. And we are doing a lot of research work also. What we are creating a voice mirror machine. We are doing virtual reality training, augmented reality training, artificial intelligence training. Yes, yes, we have created because we have got 10 years of experience in using Oculus for phobias, vertigo. So we had lot of experience. Simply our book says, whenever you talk, talk with abdominal breathing. Talk while you are swallowing, eating, crying, walking. These are the treatment they suggest for even stammering and spasmodic dysphonia. But correctly, we are not able to do it. How we will able to achieve it? That we have found out our own methods. And another important milestones, what we are doing is sound represents the color of voice. So this research we are going on continuing, and we are able to create a speech legibility, a legible speech we can give to adult boy who have lost their voice because of deafness. So they need not worry at all. We will be able to provide a reasonably good voice, good speech, where all can understand so they can live with the society. They need not be a category of differentially abled people. Hearing loss with a little or more speech problem. This I want to concentrate more. Why? This speech loss with defective hearing boys and girls, they will talk with sign language. It is good, happy, great. But my intention is they should speak only with mouth. Yes, when crying, shouting, they are able to get their voice. So why not they utilize the same sound to produce speech? So they need not be void of the speaking capacity. That is what our redirected phonation is helpful for these boys and girls who are not able to talk fluently or legibly if they are deaf. So this I want to take it as a challenge and do it. slowly. So this is very easy for us because we are able to redirect phonation for a puberphonia and stammering and muscle tension dysphonia. Little tough. I don't think every case need to be successful. A little improvement, that is more sufficient. That's what I told the story. If somebody is limping, if they are having a shoe, it is good. That's all. Why limp? Have a shoe or a crutches. So they will face the society without much problem. Similarly, hearing loss people, if they are not able to speak with the society, this is a little stigma for them. They will be able to talk with voice, with our redirected phonation. So I pray God that we will be able to succeed in our venture. So our plan is Puberphonia clinic we want to start. So thank you very much for listening. We will meet in next Saturday. Today we have finished 1,388 cases. So next week I hope we will be in the Puberphonia clinic. We will be able to relay our the same thing. I pray God for the Almighty for giving all the strength to us at our Puberphonia clinic, and we'll do more help to the generation. Thank you very much. Great, happy, great. We'll meet you.